Đã quá, amazing ơi.
Okay, quick update everyone. We recorded this video a few days ago, and I wanted to let everyone know how things are here in Vietnam as of today, February 18th. Public schools are staying closed for all of February in the big cities. Samsung is flying their phone parts to its factories in Vietnam from China as supply chains are being disrupted. Vĩnh Phúc province is being quarantined as they found 10 coronavirus cases there. In Vietnam, the total cases are currently at 16, 7 of which have recovered from the illness. No deaths reported yet in Vietnam. Alright guys, enjoy the video. Xin chào các bạn, Thầy Mike đây. I'm here today to give a PSA. A PSA is a public service announcement. In the US, sometimes the government or organizations will let the public know about an emergency. In our case here, I want to talk about the novel coronavirus, or the new name, COVID-19. And I'll help y'all practice watching and understanding the news in English. We'll go over many of the common terms you might hear when watching these programs. And I also want to talk about the basic things you can do to stay healthy. Remember, when you watch the news, it's gonna be high-level English, plus medical terms. So what I want you to do when you watch the news is try to pick out the keywords. For English learners, you may not be able to understand everything, so listen for these words and then build up from there. Are you ready? When there's a disease or threat of a disease that could spread through a large area, we can describe it based on how big of an area it affects. There are 3 basic levels. An outbreak is when we suddenly see a new disease in a small area. In this case, COVID-19 suddenly had an outbreak in Wuhan, China. Currently, it's referred to as an epidemic because it's widespread throughout mostly China. If many more cases start happening outside China, doctors will start calling it a pandemic. As of today, February 14th, it's looking like this disease will be a pandemic, much like SARS. Different news agencies are talking about how countries are reacting to the epidemic. The Hubei province and many more places in China are being quarantined to help prevent the spread of this disease. I thought it was interesting how other governments are dealing with different situations. For example, thousands of people are being quarantined on 2 different cruise ships. One of them is sailing around Southeast Asia and no country will allow them to dock. And the other one is in Japan. A woman from the ship in Japan was interviewed about how well she was being treated in the hospital there. She contracted the coronavirus and feels no symptoms, but must be quarantined for at least 14 days. If you've been in contact with others who tested positive, you will still be quarantined. Why the quarantine? Because the incubation period of this virus could be 3 to 24 days. And this number keeps changing. You could have it and not know it, and you could be contagious to others during that time. What are the symptoms of the novel coronavirus? According to the WHO, or the World Health Organization based in Geneva, Switzerland, and part of the United Nations, the symptoms are fever, cough, and shortness of breath. Now that sounds like a cold, right? The problem is for people with weak immune systems or have other diseases related to their lungs. They are more at risk. How should you protect yourself? Don't touch your face. I always touch the corners of my eyes, and this is a very easy way to let viruses and bacteria into your body. Don't do that. Disinfect your stuff. When was the last time you cleaned your phone? I don't think I ever have. Remember, touching things in public, such as handrails and doors, could have things on there that could make you sick. wash your hands, and use hand sanitizer. There's a few more things, but mostly I would say use common sense. There are things here we can all do to reduce the chance of catching a virus. Here in Vietnam, I see signs like this. These are general things you can do to prevent the spread of disease. I went to a buffet the other day and all the customers were asked to sanitize their hands before sitting down. There are also spray bottles next to our elevators and some other places too. What about face masks? Should you wear one? You should consult a doctor to be sure in your case. Some governments are telling their people to only wear them if they're sick, and others are saying to always wear them. When choosing a mask, keep in mind some of the more useful masks or respirators are called N95 masks, which creates a better seal on your face. They may be able to better filter out to smaller things, and the basic surgical mask like this may not be able to do that. Doctors think the coronavirus can be transmitted through the air, so if it is airborne, that's when a respirator might be a better option, although still not a guarantee. How's your immune system? Do you think you're immune to the novel coronavirus? No one has immunity to this virus that we know of, and there's no cure, just like there's no cure for a common cold or the flu. While there's no cure for any virus, doctors have many ways to treat the symptoms of many viruses, and the amazing doctors are working hard on a vaccine that can prevent catching the virus. Okay everyone, I really hope everyone will be healthy. We at Amazing English and Go Amazing hope all those affected by the coronavirus will have a speedy recovery. We'd like to thank the tireless efforts of all the doctors, nurses, and medical professionals for their service. Be well, everyone, and see ya. Here's a mask for you. These words are difficult. Here's a list of all the vocabulary words we covered in this video so you can practice more. Review them and watch the video again. Be healthy, guys.